Hello, everyone. This is Tijen Genco. You are tuned into Coaching with Mastery and Elegance with Tijen Genco. I am Master Certified Coach and Board Certified Health and Wellness Coach. Today, I have such a pleasure and honor to host Margaret Moore. Welcome, Margaret. How are you?
You, Tijen. It's great to be here. Thank you. I'm good.
I'm glad that you were able to join me today as we are going to talk about importance of credentialing, especially from the perspective of NBHWC, board certification for the health and wellness coaches. Before we start getting into that, how would you like to introduce yourself to our audience?
I'm happy to do that. I'm a biologist with an MBA. That's my beginnings, and I'm from Canada. I'm from the Toronto area originally. I'm now also an American citizen, so a Canadian American. And my first career was in biotechnology, developing new vaccines, cancer treatments. So I in startups, in large billion-dollar companies, marketing, business development, chief operating officer, CEO, lots of different positions in biotech. And I decided that the world needed the professional coach in healthcare. And in 2000, I started Well Coaches. And since then, I've co-founded two nonprofits, the National Board for Health and Wellness Coaching in 2010, its predecessor, and then the Institute of Coaching, based at McLean Hospital in the Mass General Brigham Harvard Medical School world, all with the intention of raising the standards and the professionalism of coaching. So I've worked very hard, both on the school side and the nonprofit side, to make coaching a science-based endeavor. And because I came from biotechnology, it's a research-based business. In fact, the products are often research and development products. I led many teams of scientists. I was very familiar of what it took to get an application to the FDA to start clinical trials, to get through the marketing process and get vaccines approved. We're much more familiar with that since COVID. So I saw coaching as both a profession and an intervention in healthcare that was much needed because, you know, when I started in 2000, even then we knew that most people were not committed and fully engaged in their own lifestyle and self-care and doing all the things that they could do to stay healthy. That we have been supported by the pharmaceutical industry in looking for medicines and pills to fix things which actually result from long-term unhealthy living. So I felt we needed the coach, the professional coach, to help people make their health and well-being a personal project and actually be engaged in improving their way of life to improve their health and well-being. So when I started in 2000, at that point, ICF had just gotten started. The first coaching schools in the life coaching, business coaching started in the mid 90s, so just a few years earlier. And in this country, not in Europe and in Australia, but in this country, it wasn't scientists that started coaching, it was practitioners. And so the first coaching schools, and to this day, the ICF competencies don't require an understanding of the science behind the phenomena that we use in coaching. Motivation, behavior change, self-efficacy, positive psychology, emotional intelligence, self-regulation, esteem, behavior, cognitive change, all of that. You really don't need to be schooled in the theories and research that support what coaches do. So my first task when I started was, originally I was going to build a team of coaches working in the corporate setting and eventually in healthcare, but I realized the curriculum wasn't there. So I started from scratch and built a team, and I went out and met Jim Prochaska of transtheoretical model and the motivational interviewing experts and self-determination theory. I started going to the positive psychology conferences in 2004.
Mhm.
All those years, learning, that was early days. And on and on. I mean, there's more than 20 theories that we draw on, and I've contributed to the scientific theories as well. So we worked really hard in those early years to build a coaching protocol that was a coaching process, a set of competencies where each of the pieces was supported by good research. And then that became the Well Coaches Protocol, which is published in our textbook. The first textbook came out 2008, 2009, took us 8 years to get it established. And then the second edition is out, and we're working on the third one now. And that protocol in the book has now been studied in the real world by researchers, and there are 22 published studies of the entirety of the protocol showing statistically significant outcomes. So we can say as a school that the protocol and the curriculum are science-based, but then it produces results in the real world that are significant. And that is unique in the coaching world, in all of the coaching world. I don't know any other school that has gone through that discipline. So I like my biotech background. It was laid out over time. So then when we gathered the industry 10 years after I started to create national standards, all of that initial work was done and published.
Hmm. Thank you so much for that, Margaret. I'm so glad that I have you here today, that get your story out, right? And I felt excited because I have an engineering background, and
Okay.
I have done my coach education in the academic environment where I studied a lot of those evidence-based methods. And then I worked in the pharma, so I was very
Oh,
familiar with the research process. So it is fabulous to hear your systemic approach to bring interventional capabilities into behavioral change toward health and well-being
yeah,
of the human beings.
yeah, yeah,
So that seems to be the motivation behind you establishing this credentialing
yeah,
standard
yeah.
to distinguish between the credentialed coach versus non-credentialed ones. What else would you like to say to that?
Well, I knew that when we were creating a new profession, we would ultimately, so the school is a private organization. It's not an academic organization. And even though we've, obviously been very disciplined in introducing and integrating science into coaching, but I knew that ultimately, for this profession to be taken seriously, we needed to have a national credential. And in about 2008 and 9, a few of us began to talk at conferences. Karen Lawson, who started the first academic program for health coaching at the University of Minnesota. Um, Duke started a program just before that. Linda Smith started that program. She was, I think, trained at CTI.
Mhm.
And then Michael Orlowski, who was a psychologist who started a wellness coaching school about 5 years after Well Coaches. And so there was a small gang of us. Ruth Wolliver was active in coaching research, the most active researcher probably at that point. So we came together and all agreed we needed to set aside our own proprietary interests and come together to agree a common standard.
Mhm.
And that took us a few years to define the tasks, to define the competencies, to agree that there was one profession, health and wellness, not a health coach and a wellness coach. That was a big accomplishment to put the two together.
Yeah.
That's huge. That took a while. And there was also groups who thought that coaching is just an add-on to other professions. It's not a standalone profession. So we had multiple views about what should happen. And it took a while to get everybody to orient around. There's one coach. it's the same coaching competencies, whether you're talking about,
Yeah.
I mean, health and well-being. Now, the latest work at Harvard and Baylor in defining the two makes a distinction between health being something you can measure with numbers quantitatively, like hypertension, blood pressure, and blood
Yeah.
glucose, and well-being being measured subjectively. So
Mm.
the internal motivation, high quality motivation, and autonomy, and self-efficacy, and things that are critical to human well-being, but are not measurable by instruments. You as an
Yeah.
individual report on that. Nobody else can. So now we've put the both together, the psychological pieces, which we know probably drive engagement in health, because you need the psychological resources to even try to change your behavior. It's hard, especially eating and
Yes.
exercise. I mean, they're much harder than many things to
Yes.
change. So, so the two have come together. We later moved from wellness to well-being because well-being became a much more robust, scientifically based topic than wellness. Wellness didn't move on. It was stuck in the models, the wheels of the 60s and 70s. And the science around well-being now, the book that I just finished co-authoring on the science of leadership
Hmm.
is a direct overlay on top of the science of well-being and coaching. It's all one thing. So well-being is and then when the American Medical Association decided to name the billing codes for coaching as health and well-being, not health or health and wellness, we took that moment as, okay, we agree well-being is more, it's just a more respected term among scientists now. So that's how we got to health and well-being, and we kept the two together. So the competencies are the same, whether you're talking about the quantitative side, the blood pressure and
Yeah.
lipids, or the qualitative. It's the same techniques. Coaching is coaching. So that was a huge accomplishment in those 5 years. And then the next 5 years, we're putting together a partnership to build an exam. And we were introduced to the National Board of Medical Examiners. David Eisenberg was working there. He's at Harvard School of Public Health now. He knew me. We'd worked together on a few things, and he introduced me to folks there. And because he found out that the National Board of Medical Examiners, which is responsible for physician licensing exams,
Hmm.
plus some other health professional, they were thinking about building a credential for health coaching, and we didn't want to have two. So we convinced them to join forces, and then we created a new entity that was sort of a 50-50. They put in several $1 million. We built the exam based on their standards, and now we have the National Board for Health and Wellness Coaching. So that deal, we signed our first letter of agreement. I think it was in 2015, early 2016. The first exam came out the next year, and now we're over 11,000 national board certified coaches. So
Yes.
the
Yes.
story.
Having to gone through that exam, I can tell you it's no joke.
No, we did a good job. Yeah, yeah,
Yeah,
yeah.
yeah. So, and I actually been to both sides. I mean, more than one side of the equation, right? I've been a coach educator, service provider to different industrial spaces, and and I also received coaching when I went through health challenges myself. So I can speak to the distinction, but what would you like to say to people that they are still on the fence that whether because credentialing comes with the cost and a lot of efforts
Yeah.
and all that, right? What would you like to say to those people thinking and trying to make a decision whether they should go through with this or not?
Right. So are you saying they're wondering, are you asking whether we're advocating for coaching training or just the credentialing?
I'm talking about in general that our viewers find these podcasts, right? If they haven't had a credential yet
Yeah.
as a coach.
But they've been trained as a coach?
Yes, or they're thinking about which credentialing path to choose, what to
Yeah.
do. And so what would you like to say to those people
Right.
trying to make a choice? Yeah.
Well, the first thing, Well Coaches stands for coaching excellence, and we mean that. And we mean that not in knowledge. I mean, passing the exam is an accomplishment, but these skills are hard to do well.
Mm-hmm.
Create the flow, the depth, the granularity, the energy, taking someone from here to there in 30, 45, 60 minutes. It's not education. It's not management. It's not leadership. It is a significant skill set. So the first and foremost thing is that you know how to do this well. Because if you don't, if you're just an educator, which there are lots and lots, and you're not good at helping people shift their mindsets and behavior in a pretty powerful way, then there is no future career because AI is going to take care of those basics. AI is perfectly designed to help people make new habits. Because that last mile of when are you going to do it? How are you going to do it? What's your backup plan? How did it go? What do you want to tweak? That's the last mile of coaching, which is for coaches gets tedious.
Yeah.
People have major issues that, like I can't do this. I don't know what, when confidence is low, motivation is wobbly, it takes some pretty significant mindset shifts. And so coaching sessions need to be masterful. They need to be excellent. They need to be compelling. They need to make a difference. People are not going to pay for coaching. Healthcare is not going to pay for coaching without strong outcomes. So if you just think you're going to become a coach and put your label out and have nice conversations, forget it, because AI will be doing that very soon. So the most important thing is that you choose the training program that produces excellence in skill, that you will know how to coach. Because if you don't know how to coach, the outcomes aren't going to be there. You're not going to get the jobs. That's the first and more, that comes way before the credential. And I think a lot of coaches, when they're shopping around, don't understand that this is a skill set, not a knowledge base. And if you're not practicing and watching masterful coaches and listening and embodying it, it is not an easy thing to do really well. And we have a lot of coaches and there's a lot of competition. And so that is by far your most important priority, is being very skilled and being part of a community that pushes you to get better and better and better. You need to make more happen in less time so that people want to come back because they can't get this anywhere else. And that's powerful coaching. So that's the first thing. That comes before the credentials. The second thing is that going for a credential means that you are taking a stand for a standard, for a profession. Let me compare dietetics to personal training. Personal trainers do really well when they're very skilled, but there is no national exam. So there's a gazillion certifications. You can get a certification in a weekend. Certification doesn't mean very much. Skill matters most. So personal trainers have a great big business in the consumer, but they're not in healthcare. It's not part of healthcare, even though exercise is, along with nutrition, are the two most important things you can do to stay healthy, prevent disease, and yet it's not part of healthcare. A little bit of cardiac rehab, a little bit. So exercise didn't make it into healthcare. On the other hand, dietitians have the credentials and the licenses, but they're not rocking it like personal trainers because the skill of making intensive changes is not as, the knowledge is there, the intention is there, and there are some great dietitians, but they have a national standard and they've got some, not as much as they should, because I think there's more that they can do. Ideally, they're coaches as well, because education, only goes so far. If you don't know how to help people actually implement healthy, and also healthy eating is harder.
Yeah.
You need all the skills around cooking and shopping and
Yeah.
preparing and
Culture.
I mean it's the hardest. It's a complex set of behaviors. And so you need both. So dietitians are in the healthcare community, but they're not as big as they could be because I think they need broader skills. Because nutrition isn't the whole story, and it's very hard to change those habits. So you want both. You want great skills and you want national standards that are respected. So you play in healthcare. So coaching, we're trying to do both, and as a result, I mean, most professions take 3 decades. I'm 5 years away from 30 years, so hopefully we'll be there. But we're moving pretty quickly as a profession, but there's still more further to go, a lot, and and that's my next frontier. But that's so the credential is what when you say this is a serious profession. We are all meeting the same standard. We vary in our skill, but nevertheless, we are saying national standards matter. Having the National Board of Medical Examiners behind the exam means that you've got an excellent credential. We built that exam. It's very good. It's a great test on top of great skills. And so you want both. You want to be superb at coaching, and then you want to say, I'm waving the flag for this being a serious profession that has serious standards that are allowing us to play in the healthcare space. So it's really two-pronged, skill and credential.
Yeah.
And
Yeah.
they're separate. They're separate because the test is a test. It doesn't test skill. So you
Yeah, correct.
can't guarantee that an exam is going to prove that you're a great coach.
Absolutely.
And so that's why I say it's both.
Absolutely. Yeah. It's the theoretical knowledge, but the application comes from
Yeah.
really application. So we haven't talked about, we're recording this within the United States, at least that's where I am right now. I'm assuming you are too.
Yeah.
So what would you like our worldwide audience to know about, if anything, that they're
Oh,
able to take
yeah.
this?
So the national board exam, we actually called it the International Consortium for a while, but it's just too hard to take a credential globally. There are lots of people getting the US exam. Hopefully the NBHWC, I'm not on the board now. My term is up. But though that they may move to having an international board with an international exam, but each country has its own dynamic around national standards. The UK is trying.
Mhm.
They have they've built a standard. Um, I'm where Well Coaches has traveled, which is China. Our textbook is translated into Mandarin, Singapore, Australia, Mexico, Brazil, Israel. I'm sure I'm forgetting something. So in all those countries, Well Coaches has partners, and there still aren't national standards. So
Mhm.
it takes, I mean, it took 10 of us working 1 or 2 days a week for years as volunteers. I mean, it's
Absolutely.
a huge commitment.
Yes.
And in the end, you create a field, um, and um, and you do it for the greater good. You really do. And that's hard to do. It's hard for people to not get paid to work so hard for the greater good. So it's not an easy thing to do. It just takes a while. And so,
Absolutely.
we've set the pace here, but and it will happen, but it will, the issues are the same everywhere. The
Yeah.
the results is the coach part of the healthcare team. How do they get paid? What's their role? It'll happen. Um, uh, but it just takes the time it takes, and it takes a very dedicated group working for everybody as
Uh,
volunteers.
yeah. Yeah. Thank you for that. Was there anything that you wanted to mention about within the topic of credentialing? I haven't asked that you wish to share with the audience as we bring this to closure.
Yes, I mean, I think coach credentials matter. In coaching in healthcare, the literature shows that roughly 20% of coaches' time is spent in education because people don't know everything they need to know about their medical circumstances. And so it's just understood that we don't lead with it, but it's part of what we're doing. Not the major part, but it's an important part. So those are the big ones for coaches here.
Yeah.
We provide 2 tracks because a lot of coaches want to work in both. And our advanced training is an ICF accredited program. We've made room for both. In summarizing the science of leadership, you see the science of well-being and coaching. And so that would be a good textbook for the field as well. I really think coaches all need to read this book if they're in the business end. So, so we're still working hard to help coaches know what they need to know. I mean, coming out of biotech, there is so much good science, and if you really understand it, it works. It provides an immense variety of tools you can use. And so you do it not because you love science, but because it gives you, we take the theories and turn them into a set of questions, a set of open questions, inquiry. Appreciative inquiry is an inquiry. Cognitive, social cognitive theory, you can turn that into an inquiry. Motivate, all these things turn in. And then all of a sudden you have all these great coaching questions and all these places to go. You've got endless possibilities. So, it's a joy to be able to apply the science and to understand it and to keep learning. So, it's both. It both works. It provides endless nourishment and learning for coaches. And, it just means it's a rich experience because there's so much to learn.
Absolutely. And carrying both the ICF and the NBHWC certification, I can attest to that. So as we bring this to closure, what you've been sharing some of the resources as well as your organization, but anything else you wish our audience to know when they're interested in finding you or the offerings?
Yeah, thank you. So my webpage is coachmeg.com, and there's lots of videos and resources there. I'm going on to 5 books, 10 book chapters, 28 papers. We just had a new paper accepted in a scientific journal. We built a well-being coaching inventory, which is adapting all the great science around well-being into a coachable assessment that clients and coaches can unpack, where each of the items has a science basis behind it. Very straightforward. Assessments are designed to assess, not to coach. So that contributes something. So that's just coming out, and that assessment's available where will be in the public domain. So
how will the people find that?
It'll be we will, if you go to Well Coach, just sign up for the newsletter, and we've always got resources every month. Yeah. And then the Well Coaches training, even if you've been trained elsewhere, we have a lot of ICF certified coaches coming through Well Coaches because they don't get the well-being side and they don't get the science side elsewhere. So and it's affordable, it's less than $3,000 for the whole package. And in fact, our core, the first module, which is about 40 hours in total, is, less than $2,000. And so it's a really good way to expand, if you're ICF, into well-being and get a science. We have lots of PCCs that have found it very beneficial. And then the Institute of Coaching has 3,000 resources in its library on science and coaching, and lots of great webinars. I've written 100 research doses, which is just taking a scientific article and translating it into coaching practice. So that's another incredible resource base. And then there's a conference there. We've had 15 conferences. All the videos from the conferences are in the database. So fabulous resources there. So that's a good start.
Excellent. Well, thank you, Margaret. And everybody, thank you for tuned into us. And if you missed in the beginning, this is Coaching with Mastery and Elegance with Tijen Genco. And remember to subscribe. And we will also put all what we discussed and Margaret's links into the show notes. And thank you for being with us, Margaret. And thank you, everybody, for tuning in.
Thank you so much. And I love the Mastery and Elegance. You can count me in on those two.
Thanks.
Okay.